Okay, color-coded tubes are used at the center of modern phlebotomy. Which tube depends on what order of test is being ordered. Each tube may contain different sets of additives, which are chemicals designed to promote or prevent certain changes in the blood sample. The types of blood specimens that we are encountering with in the order of draw: whole blood, serum, and plasma. Within these whole blood, serum, and plasma, there's tube additives. Two additives are identified by the stopper color, or the color tube, and many tubes are coated with silicone to prevent blood from adhering to the wall and to slow clotting. The types of additives that are inside each specimen are anticoagulants, which are used to prevent blood from clotting. Different anticoagulants work in different ways to prevent clotting and yield plasma. For example, EDTA, citrate, oxalate bind to calcium, and heparin inhibits conversion of prothrombin to thrombin. So heparin is like a blood thinner, and EDTA is to encourage clotting. The choice of coagulant is determined by the test done. Clot activators, such as thrombin, directly increase clotting and is used for stat serum chemistry determinations, or if the patient is on anticoagulants. Clot activators may be adhered to the side of the tube, therefore the sample must be inverted 5 times to allow blood to come in contact with the activator. 5 to 8 is the minimum expectancy. Antiglycolytic agents, such as sodium fluoride and lithium iodatate, are used as an alternate to inhibit glycosis and can be used for glycose determination or sugar. And lastly, polymer gel, an inert synthetic substance whose density is between that of cells or blood serum or plasma. When the specimen is centrifuged, the gel becomes a liquid and moves between the lower cell layer and the upper serum of plasma layer. So those are the main things that we have inside of these order of draw. Now the types of tubes that we're going to be encountering goes like this: stop light red, stay put green light go. Stop means sterile or yellow. Its additive is sodium polyethynyl sulfonate to inhibit complement and phagocytosis. Its specimen use is whole blood. You use this tube to recover microorganism causing blood infection. So as you can see, stay is yellow. Then you have light blue, which is used for coagulation tests or prothrombin time tests. Its additive is sodium citrate, about 3.2% of it, and it's an anticoagulant. Specimen used is double spun plasma. So as you can see, light blue. So it's stop light blue. Then we have stoplight red. Red uses for chemistry, serology, blood bank, and its additive is clot activators and plastic. So there's really nothing in this, it's just whole blood. And it's typically 4 hours and it's serum, what you're trying to extract. So it's stoplight red. And now we have stay. So this is a tiger top, or it can be gold, and it's used in most chemistry tests. It's called a serum separator test. And its additive is a clot activator with polymer gel, with or without, depending on the test, and its specimen is serum. So this is stoplight red, stay, for serum separator, SST. Put is our next one. The tube is light green or green gray. Its test is statin routine chemistry test. It's a PST, and its additive is heparin and polymer gel, with or without, depending on the test, and it's also used with double spun plasma. Called before is a blood thinner. So you would vary on the cases depending if the person's already on heparin, which would vary the results of doing it quicker. So this one is a very important one to know. So this is put, light green. Now we have green. As you can see here, it's just a perfectly green top, and the test is used to statin routine chemistry test as the last one, but this one deals with ammonia, electrolytes, arterial blood gases, or ABGs. Its additive is sodium heparin, lithium heparin, or ammonium heparin. So it's a more vast majority of them, and it's used with double spun plasma. So this is green. We're almost done. Light, or lavender, as you can see here, is used to collect CBC, or complete blood counts, where it has white blood cells, red blood cells, and platelets. So those are really important. It also can measure your sedimentation rate, your routine immunohematology, and its additive that it uses is an anticoagulant known as EDTA. Its specimen is whole blood. So, gotta be careful with that. This cannot be out more than 4 hours, and it's usually room temperature. And our last one, GO. GO is gray. Gray is a lactic acid tests are used for lactic acid measurements, glucose tolerance tests, fasting blood sugars or FBS, and blood alcohol levels. So for example, if you were going off to take a test and someone wants to measure your alcohol levels because you say you're not drinking any of that, they would use this gray tube to see how far in the alcohol blood test your things are, possibly higher than the 0.8%, which is really bad if you're driving. The additive is an antiglycotic agent that preserves glucose, perhaps the anticoagulant potassium oxalate or heparin, but it's more on potassium oxalate, and that's where it's at. And its specimen is plasma. So that concludes it. The acronym is stoplight red, stay put, green light go. Thank you for watching.